how can we better tailor the medicine experience and all of medicine specifically to a person? And nothing is more personal than somebody's DNA. I see personalized medicine as this new wave of diagnostics that better prepares a clinician or healthcare provider to take care of a patient kind of with a little bit of foresight.
RenaissanceRx is a personalized medicine company. We specialize in toxicology and in pharmacogenetic testing. Toxicology specifically to monitor what drugs patients are taking. And then for pharmacogenetic testing, we're looking at a patient's DNA to see how well they would metabolize specific types of drugs.
Traditionally, doctors would ask me for my symptoms, and based on these symptoms, they would prescribe a possible medications and send me home. This method is flawed in the sense that we do not take into account what my genetics is. There might be a particular genetic variance in my genetic makeups that does not allow me to metabolize this drug effectively, in which case it's really toxic for my body. So now patient care can actually be more effective and safer based on a person's genetic makeup.
We may be able to affect hundreds of thousands, if not millions of lives through this type of technology. The science, it's been around for a while. The fact of the matter is that only recently, only in the last couple of years, has the technology just taken off. In the future, we think that technology will be pushing the science.
We're right at the cusp of moving from an intuitive approach to medicine to a precision approach to medicine. Actually, before a physician would write a script for a patient, he would know how that patient is going to metabolize that medication. Right now, it's a guessing game. Why not know on the front end?
With this information, a physician can then use the known genetic information in conjunction with the certain risk factors that only the person's individual physician would know to advance how they manage that patient.
Our idea is that if, based off their DNA profile, we're able to better tailor the medications to the patient when they start on them, we don't have to go through this cycle of failing a medication before finding out what's appropriate for them. We're providing a brand new way to approach medicine and take care of your patients from the very start.
For a patient, it means that they can have an assurance that if they have a physician that's working with Renaissance, that he's going to have much better information in regards to how they metabolize medications, what medications they should be taking, and what medications they should really avoid.
We have invested a lot in our technologies, both within the laboratory to get the clinical results we get, but also in our IT, in the manner in which we can get this information to physicians so they can use it to manage their patients and also use it in an expeditious manner to where they can actually have an actionable report that allows them to execute and advance medically managing a patient without really having to break stride through the normal course of their day.
We have a great IT platform, an amazing competitive advantage from that standpoint, really be in the forefront to give support to the physicians as to how they can use our technology.
With our portal, we're also able to see, depending on the drugs that are reported into the system, when the physician goes in and adds a new prescribed drug, whether or not there would be a potential drug-to-drug interaction. And then if a physician has a question about a change in dosage, they can follow up with the customer support team. We'll put them in touch with that pharmacist that made that recommendation, so then they can feel confident in the changes that they're recommending to their patient.
It's a great tool to have a DNA test available to you, able to see what are the drug reactions, what are things you should not be taking, and to do that on a real-time basis with the benefit of the physicians give you advice on that. I think it's a very safe and just a common sense solution for everyone today.
We want to go and be focused on patient-centric results. The fact of the matter is that if we provide a test that doesn't give patients benefits or give clinicians better, more precise ways of affecting patient care, we failed on some level. The core of who we are is that we're always in that discovery mode. We want to be the innovators. We want to be the people that go and lead the industry and lead the technology to be able to allow patients to have better results faster.